Hello everyone and welcome back to my channel. Myself Dr. Surbhi Sahni. Hope you are doing great. Today we are come forward with the NEET PG 2023 exam analysis and with the recall questions. We have to talk about the exam difficulty level, the clinical based question, whether the questions are repeated or not. So as we know that today we had the NEET PG 2023 paper and we found that it is quite tough as compared to that of the last year paper, that is the NEET PG 2022 paper. Paper was lengthy plus tricky. That means the questions are time consuming questions. Mostly that means 50 to 60% questions are clinical based questions, and out of which 120 to 125 questions we can say they are totally clinically based question, that too from the main subjects of final year, that is the obs and gynae, dermatology, pathology. That means the most of the subject weightage are given to these three main subjects, that is dermatology, pathology and obs and gynae. There are many questions in which the options are quite confusing, which make the paper little tricky. 10 to 15% one-liner questions are there. Around 25 to 28 image-based questions are also there. So, overall the paper is moderate or bit towards the tough part. A lot of questions is there on vitamins topic. Nearly about 7 to 8 questions are there. 2 to 3 questions are on gout. And we found that also that there are questions which are quite repeated as that from the last year paper. That is, there are few questions which are repeated in NEET PG 2021 paper and definitely repeated this year in today's paper also. Even if students have a lot of distractions before examination regarding its postponement, repeated questions are there but they are less. Repeated questions are there from NEET PG 2021 paper. First year questions are there but they are quite less. More and more questions are coming from the second year and the final year subjects. Now let's see the recall questions, right, which you have already DM me on my Instagram story. So if you haven't followed me on my Instagram story, here is the link of the Instagram story in the description of this video. Along with that, you can see the Instagram ID on screen. So don't forget to follow me there. Now back to the topic. Let's see the recall questions of NEET PG 2023. The first recall question is the asthmatic patient with the candidiasis treatment, and they are asking about the drug. So cotrimoxazole is the answer. Second question is the pulmonary fibrosis and hypothyroid side effects of which drug? So the answer is on your screen. Third one is the nerve injury MC in laparoscopic hernia surgery. So the answer is the lateral cutaneous nerve of thigh. Fourth recall question is farmer has a history of ingestion and later on the atropine started, later it developed the fever. So what will be the cause? Definitely very easy answer, that is the atropine toxicity. Next recall question is the history of ingestion of raw egg over the years. So vitamin likely to be deficient is vitamin B. The recall question is woman with the vaginal discharge having the history of multiple sex partner, which kit is to be used? The answer is green. Another recall question, definitely the clinical based question. A child with cola colored urine, BP normal, creatinine 2.4 and with the history of pyoderma 2 weeks back. Resistance of symptoms even after 3 weeks with creatinine 3.2 on microscopy. Then what you will see? The answer is the RPGN crescent is seen. And the last recall question is there is an image whose answer is the image of limbal dermoid was given. Another recall question is the pansystolic murmur image was given and that is seen in mitral regurgitation. So that's all about the today's recall question from the NEET PG 2023. If you still remember any other question, you can comment down. Overall, the paper is quite moderate or a moderate plus we can say. So let's hope for the best. If you still have any query, you can drop me the mail which is shown on your